you, Dr. Gulani. I'm back again for my routine visit, and it's been 3 years since I had my surgery, and I'm still seeing 20/20. I want to tell you I appreciate you taking the time to sit and talk with me on this busy Monday morning, but I'm so appreciative of everything that's been done. You took a complex case that no one throughout the United States or Canada would even consider, and it was totally successful with my perfect eyesight.
Well, always a pleasure. For all of you radial keratotomy patients out there, Susan wanted to interview, I call it grill me, right? My patients. Yes, it's Monday morning. We are very busy. Patients are landing from all over the world. Many of them are radial keratotomy complication cases for surgery this week. But always a pleasure to meet and sit down and share as much as I can to inspire my colleagues to not give up on radial keratotomy patients and to give hope to RK patients too. So, as I taught you all in many previous videos, radial keratotomy is a complex situation. One, because of measurability being inaccurate, and second, it's also changing, and on top of that, makes the surgery anatomically difficult. What is unique about Susan's eyes is that this is another topic I've taught. Even though she wasn't 20 or 30 cut RK, she was less than that. But the fact that her eyes are so small, very small eyeballs, and in a very deep orbit, made it very difficult to access. On top of that, her RK was very flat. You know, RK cornea, because of the cuts, become flat. She was very flat, very small eyeball, and a very deep eye in the orbit. So the approach itself became very risky, dangerous, and difficult. In fact, for you, if you remember, Susan, I actually designed a special speculum.
Yes.
I designed a special speculum that we could put into this very small orbit and open her eyes without hurting her for the surgery. And then we had to operate in very little space between her flat cornea, RK, and her very hard cataract. So we did a LaZrPlastique based surgery using a toric premium lens technology on axis for her very high irregular astigmatism. So she had less than 20 cuts, but what made it very complex was the flat cornea, the high irregular astigmatism, the scarring, the dense cataract, and the difficult approach to her eye, in addition to you having very severe blepharospasm, right?
Yes, all of those were very complex.
Her eyes basically squeeze when you're operating. So all those things made it a very complex case, and again, underscores what I've taught you all before all the time, that it's not just the number of cuts, but the associated factors that makes the surgery even more complex and less predictable. But now I'm talking for the surgeons and doctors. No matter how complex she is, your desire to give her perfection should never go down. So even though I don't guarantee any of y'all vision and outcomes, it's my pleasure that many of you are landing with vision, and that too without glasses and contacts. And we measured you today again at 3 years post-op.
Exactly, exactly.
And 2020 makes me so happy. So this is very, very important to understand. Just because you've had radial keratotomy surgery and now you're cataract age, yes, you are complex, but you're not impossible. Second, do not fall for the hype of technology and lenses. They are just ingredients. I see number of patients, in fact, today who are landing who had cataract surgery elsewhere with their RK cases and had bad outcomes or distorted vision, and it's not the lens to blame. The lenses are all made well. It's which lens to use and which technique and which case. Again, uniquely complex. So think outside that. I want surgeons to fight very hard, even modify your tools, technologies. You're all welcome to use the technologies or instruments that I have designed that are available freely to help these patients. And that's very vital, because just seeing y'all dressed up like this, coordinated, so happy, traveling here just to say hi to me, I cannot thank y'all. I'm indebted to y'all, Susan, all of you, because y'all are allowing me to execute my passion. It's a pleasure. And then I'll be teaching actually next month at the Academy in California, our national meeting for eye surgeons. And I love to share these things. But when a patient asks me, can you sit down and explain a few things of what you did with me for benefit of other RK patients, it's always a yes.
Well, one thing that I was most impressed of when I first came, you examined me thoroughly, and then you said, I want you to come back in a week. Let's put it off. I want to do all these exams over. It was a very thorough eye exam. 1 week and then come back for additional week. He called me several times. I'm studying this very thoroughly to make sure that we have everything in place before your surgery.
Right.
It wasn't just a run through, get your eyes examined and schedule surgery.
No.
He took his time, explained everything very thoroughly to myself and my husband before it took place. And I cannot tell you how much I'm pleased with the results. Again, seeing 2020 after so many people had told me that there was nothing that could be done.
My pleasure. And even yesterday, Susan, as you know, for all patients landing today for surgery this week, we spent hours this Sunday again planning. I call it meditating with all the data, because all of your data are so inaccurate despite all the technologies I have. So, in summary, again, my patients, anytime. Susan, a pleasure seeing you again.
Thank you so much.
So happy for you. And patients, don't give up, please. Encourage your doctors to perform for you. Do not fall for advertising hype of just technologies and stuff. There's nothing made for RKIs, and you don't want any shortchanging. You want the doctor to work very hard, measure you once, twice, as many times needed. Plan for y'all, and then execute the surgery. Was there any pain in surgery?
No pain.
You had surgery in our cataract suite in our spa?
Yes.
And without anesthesia, with just numbing drops, despite your complexity.
Everything went just as planned.
And that's the basis of LaZrPlastique for everybody out there. No pain, there is no stitches, right? Despite the way you had your RK and scars, and using the premium technology, but to optically correct the abnormal visual impact of the cornea that she still has. That's the plan, that part that I want you to understand. She still has a distorted cut cornea from RK, but despite that, optically she's seeing excellent through it. That's the basis of LaZrPlastique beyond just routine cataract surgery. So I want you to please understand that. And even though I repeat this, even though I don't guarantee results to anybody because it's RK, I'm blessed with these results for over 3 decades. And at least I want you, all patients, to have hope, and I want your doctors to feel encouraged. And on seeing these videos that are totally impromptu, there are no scripts, there's no teleprompter, and there's no Starbucks card for each of us. These are real things, and I really want to keep inspiring, and hope you all get to see the best you can. So,
thank you so much.
An honor always.
Thank you.
Safe travels back.